Welcome back. With each passing day, the issue of vaccine shortage or perceived shortage is also being addressed. Even today, as we speak, states have got more than about 1.7 crore doses at their disposal to administer. But the biggest challenge is for you and me to ensure that we get that shot of life, we get that Sanjeevani, and we also tell everybody we meet to get that jab. We have undertaken, as part of our campaign, the Network 18 Federal Bank initiative with our partners Apollo 24/7 and United Way Mumbai, an NGO, that we will at least spread the awareness on vaccination across 500 villages, over 5 districts, across 5 states, all over the country. The update on the Sanjeevani Ki Gadi, that is at the center of this campaign. As per information gathered, doctors and volunteers on 4 vans covered 8 villages in all yesterday. 7 days after its launch, the Sanjeevani Gadi has travelled across some of the worst affected districts in India, including Amritsar, Indore, Nashik and Dakshin Kannada, having covered in all about 62 villages so far, reaching out to more than 28,400 beneficiaries who've been counselled and sensitized on the need for vaccinations, and a lot of them have also been helped with registration and also going up to the vaccine center. The aim is to reach 500 villages. The 5th van will begin operations in Guntur from the 4th of June. Now, the daily numbers of those being vaccinated in India continues to grow. As of today, more than 27,80,000 vaccine doses, so close to nearly 2.8 million doses have been administered in the last 24 hours. The total number of vaccine doses given until now has crossed the 21.6 crore mark. Over 4.48 crore people have received both their vaccine doses and have been fully vaccinated, while over 17.12 crore people have received their first jab. Meanwhile, the centre has said that more than 23 crore doses of vaccine have been made available to states and union territories for free. States and union territories currently have more than 1.57 crore vaccine doses available with them. Meanwhile, the centre has said that there will be no change in the vaccine strategy currently in place as of now. Niti Aayog member Dr. V.K. Paul said in a briefing that 2 different vaccines cannot be mixed, and doing so may lead to a reaction. Dr. Paul said that studies will be conducted on the viability of mixing vaccines or a cocktail of vaccines. Until then, vaccines must not be mixed. Dr. Paul further clarified that there is no single-dose Covishield vaccine. Both Covaxin and Covishield have to be taken in 2 doses as per the norms currently in place. This after sources suggested that a government panel will study the efficacy of a single Covishield shot and the feasibility of mixing vaccine doses.
कहा जा रहा है कि कोविशील्ड की अब 1 डोज लगेगी, तो मैं ये बिल्कुल साफ करना चाहूँगा ऑन बिहाफ ऑफ ऑल ऑफ अस कि कोविशील्ड का शेड्यूल भारत का जो है वो 2 डोज का शेड्यूल है. देयर इज नो चेंज, देयर इज एब्सोल्युटली नो चेंज. कोवैक्सीन का भी 2 डोज का शेड्यूल है. मिक्सिंग ऑफ वैक्सीन की बात हुई है, तो उसके बारे में एक पॉसिबिलिटी ये है कि बॉडी को दूसरे वैक्सीन से खूब रिएक्शन हो, खराबी कर सकता है. ये एक साइंटिफिक कंसिडरेशन. दूसरी ओर साइंस ये भी इंडिकेट करती है possibility of positive effect is also plausible, and therefore there is research going on in other countries. Till then, there is no mixing of vaccines.
Well, Maria Shakil now joins us with more on this. Maria, so clearly the queries as far as dosages and vaccine mixing of doses and also single shot of Covishield, all of that has been answered as of now, saying there is no mixing before tests conclusively prove that it is safe.
Yes, that's right. Because, Anand, as far as India is concerned, there have been no tests or trials that have been done. And that is the reason why V.K. Paul, who is the member health and the senior member of the COVID task force, has clearly and categorically said that the 2 vaccines that are there currently in India, that is Covaxin and Covishield, cannot be mixed. There is still, trials or results which have to come in, whether which will ensure higher efficacy or whether it will be dangerous or perhaps more troublesome. So wait till the time this mixing trial studies are through and India specific results are there in the public domain. So government is being careful because no mixing of jabs is the message that is coming right now. And also, Anand, there were certain reports that have surfaced, particularly to do with Covishield, that government is looking at perhaps Covishield being just a single dose, just as Sputnik V. Now, the COVID task force is clearly saying that as far as any vaccine in India is concerned, be it Covishield or Covaxin, it has to be both the doses and not just a single dose.
Yep.
And as far as Covishield is concerned, it has to be a gap between the first and the second dose should be around 12 to 14 weeks.
Yeah, just because in a village there was a mistake and thankfully there was no adverse effect doesn't mean we can do a mix and match of vaccines. The cocktail of vaccines only comes under Sputnik V, where the two doses are actually a cocktail because that's how it's been designed. Maria, thank you for your inputs. And even as we say hello to Anand Chulani, he's a success coach and a leading mental and emotional fitness expert joining us here on the broadcast. The Prime Minister's meeting has started in terms of whether or not there should be boards. Oh, anxiety at so many levels, Anandji, as you join me this evening. Be it doctors, healthcare workers, parents, students, everybody, sports persons, you worked with a lot of them. In terms of mental fitness, anxiety, this is very critical. How important is getting the vaccine to get a load off your chest? Let me start from there.
Yeah, to me, the vaccine is very important because right now what we're facing is massive uncertainty. And I think the vaccine, besides the medical benefit of it, which is obviously there, it also helps us give us inner certainty, right, in terms of what's going on. And that's what we can control right now, is how we take care of ourselves. And, I know everyone wants to take care of everyone else, but the first person we have to take care of is ourselves. On the plane, they tell you the first person to put oxygen on is you. So get yourself vaccinated. I've got myself vaccinated, and I'm on this call today, right? I'm taking care of me so that I can serve people on this call.
Absolutely, but tell us, how do we do it, and what are the issues that you faced, especially over the last 18 months? Because there are challenges. Life has become increasingly stressful, and there are many cases of anxiety, depression, mental health is a cause for concern. But this pandemic has opened a very ugly demon, with a lot of people not even realizing that they are getting into the phase of anxiety or even depression.
That's a great question. Anand, there are two things. One is to remember we're fighting two things. We're fighting COVID, and we're fighting the fear of COVID and the fears that COVID brings in us. And I think it's really, really important in this is to remember one thing. I've had a lot of cases in the last 18 months in my work I've had more anxiety patients in the last year and a half than I've had in 20 years. More depression patients, more relationships that are challenged, more people, challenged at home. And I think this virus is challenging us at our deepest level. And we're used to handling, what is anxiety? Anxiety is just a situation of facing uncertainty, but not feeling in control. And therefore our mind overthinks and we go into that kind of negative spiral. But here's the thing I would tell you about anxiety. There's two things we can choose right now. We can choose fear or we can choose faith. And they're similar things, but different sides of the same coin. Our imagination, if undirected, pulls us into fear. If directed, pulls us into faith. And I think the biggest thing I can tell people right now is, with all the anxiety, is remember one thing. There's a lot of uncertainty right now, but we have all gone through uncertainty. If you're a parent listening to or watching this right now, having a child is uncertainty. Starting a business is uncertainty. It's not like you haven't dealt with uncertainty before. You've dealt with it, but maybe it was in one area of your life. Now it's in all areas of your life, which means you need to have a different level of toolkit and mindset to handle it and give up. You mentioned the vaccine, Anand. I believe we all need right now the mental vaccine. Yeah. And the mental vaccine to me is what's within us. Yeah. Our courage, our self-belief, our determination, our caring, our compassion, our gratitude. These emotions are within us. And being fearless doesn't mean having no fear. In fact, we need fear in the world today because fear is a natural response in the body to say, be careful, right? Being fearless and senseless are two different things. Fearless means I understand there's a challenge out there. I'm going to put my mask on. I'm going to get vaccinated. I'm going to take all those precautions, but I'm not going to choose to live my life and indulge mentally every day in my thoughts in fear. I'm going to pull myself out of that prison and realize that I can come from faith. There are other emotions in me that I've used in other times of uncertainty, courage, inner strength, all the ones I've mentioned before. I can use them now, and I can combine them. You know, you said earlier we can't combine physical vaccines, but with mental vaccines you can. You can have courage and faith. You can have faith and compassion. You can combine those because we need as much mentally and emotionally right now to be immunized against this fear.
But the thing is, what happens is invariably people end up making a mountain of a molehill rather than making a molehill of a mountain. And in these cases, let's look at the news developing all around us. You know, the cricket team is going to go, and the women's cricket team is going to go and play a tour in England. Again, it's a challenge, but you're not getting any time to acclimatize. You're not getting any warm-up games. So you're going straight and playing a test match. So the first anxiety is, how am I going to do that? With students. Students are looking at whether or not there are going to be board exams. If there are going to be board exams conducted, how am I going to write it at an exam center? What if something happens? Everybody is bothered about what if.
Yes.
The same parent who's wondering, what if my child doesn't score well, today is wondering, why should my child write the exam? So at some point in time, the anxiety differs. The issue we worry about differs. But one thing which is constant is we worry.
That's well, to me, what is worrying? It's our thoughts getting out of control. What are thoughts? What is thinking? It's a process of asking ourselves a question and getting an answer, like a Google search. That's what thinking is. So if we ask questions like what if, and if we stack those questions, what if this happens, what if that happens, what if that, we're going to take ourselves into a place of worry. We're going to take ourselves into a place of feeling even more uncertain. Change the what if question to a how can I question. Because now you're focusing on the solution. Now you're focusing on what I can control. Instead of what happens to my child, how can I give my child courage? Instead of what happens to my future, how do I commit even more to my dreams and find a way? And if you're a student listening to this, I'll tell you one thing. You know, there's a great phrase I love, which is God's delays are not God's denials. Your dreams may be delayed, but they're not denied. Have them every day. Wake up them every day. Believe in them every day. See them every day. That faith in those dreams will pull you through this. They've not gone. Just because you can't see them doesn't mean they won't happen. We've all been taught, see it, then I'll believe it. I believe that's rubbish. We need to believe it to see it. Right now, COVID is a test of our beliefs. It's a test of our faith. And it's a test of where our focus is. And I truly believe where focus goes, energy flows. We can focus on the death and the destruction, or we can focus on the number of people that are being helped.
Yeah.
I did a session, recently, Anand, for UNESCO, for this in India, in Mumbai, for a COVID center. And, all these doctors and nurses came on. And they're there and they're worried. And they're focusing on the number of deaths a day. And I told them, what's the number right now? And they said, we've gone from 18 a day to 4 a day. And I said to them, you can focus on the 4. And of course, you need to help those.
Yeah.
But you can also focus on the 14 lives that you're saving every day.
Correct.
You can also focus on the 14 families that you're returning their family members to. If you focus on that, you focus on what you're doing instead of what you're not doing, it'll give you the strength to keep doing it. It'll give you the energy to keep going.
No, absolutely. And you focus on the recoveries, then you're focusing your energies towards the recoveries, and you're not focusing it towards, deaths and ailment. You're looking at recoveries, and that's where the focus has to be. You have to look at what you can control and what you can do, rather than what you can't control and what you can't do. Very easy to say it, but it's very difficult to get it, put it into practice and to continue to do it. Anand, thank you very, very much. It's been wonderful speaking to you, and we look forward to you joining us again in a longer session very, very soon. We'll do that. Thank you very much for joining us here on this Sanjeevani segment on The Nation at 5. And news is coming through. The that the meeting with the Prime Minister, that the Raksha Mantri Rajnath Singh, Prakash Javadekar is present, and the Education Secretary and other officials are also present in this meeting. The details are flashing at the bottom of your screens. We're going to take a very, very short break. Stay with us.